Welcome to our video about Halitosis Cure. Are you in search for a halitosis cure? If you suffer from chronic bad breath, you're not alone. Over 90 million people suffer from chronic bad breath, and the main cause is poor oral hygiene. Bad hygiene leaves debris and bacteria in the mouth, causing volatile sulfur compounds to produce foul breath. And despite popular belief, halitosis cannot be cured by chewing gum, using mints, or using normal mouthwash. Instead, there are several natural and effective methods for halitosis cure. Cardamoms cure halitosis. Among the many remedies for bad breath, cardamom is among the most popular. The fruit and spice come in three forms: whole pods, seeds, and powder. The seeds retain their flavor for longer, while the powder works to eliminate the bacteria responsible for bad breath. It also contains a compound called cineol, which relieves digestive spasms and acts as a muscle relaxant. In addition to its benefits for oral health, cardamom is effective against respiratory illnesses, such as asthma and sinus infections. Some cultures have found cardamom pods to be effective in fighting bad breath. Today, some companies have added cardamom seeds to their gums, as it fights several types of oral bacteria. One study shows that cardamom seeds reduce the amount of oral bacteria by 54%, and that its extract prevents the growth of 5 different types of oral bacteria. This is impressive news for halitosis sufferers. Other benefits of cardamom include its high antioxidant capacity, diuretic effect, and blood pressure controlling properties. Depending on your preference, you can chew on cardamoms to control your blood pressure. Also, you can add cardamom to rice dishes made with low salt content, such as brown rice vegetable pulao. Cardamom contains a compound called cineol, which is responsible for maintaining oral hygiene. Saline nasal spray. If you are suffering from halitosis, you should take note that the condition can be caused by bacteria in the nose. These bacteria produce sulfur, which is what gives your breath that odor. Bacteria in the mouth can also cause halitosis if they live in the nasal passages. These bacteria can be harmful to your health and your self-esteem. Luckily, there are several treatments for halitosis. About 90% of all halitosis cases are caused by oral problems. Some of these problems include tonsillitis, tonsil stones, and other bacterial infections. Another common cause is sinusitis. People with sinus issues may experience halitosis because their nasal cavities are moist and filled with mucus. Saline nasal spray can help relieve these symptoms. The saline solution can be applied with a bulb syringe, a neti pot, or a plastic squirt bottle. The saline solution can be made with water that is either distilled or sterile. To make the solution, boil tap water for 3 to 5 minutes and let it cool to room temperature. Add a teaspoon of baking soda or salt to the water. Poor oral hygiene. The good news is that there are a few simple ways to stop halitosis. While poor oral hygiene isn't a cure for halitosis, it can alleviate the problem significantly. While there are some medical issues outside the mouth that can lead to halitosis, the problem is usually treatable. It is best to have good oral hygiene and regularly see your dentist. If you wear dentures, make sure they fit correctly and take them out before bed. Improper oral hygiene can lead to halitosis in many people. If you don't brush your teeth regularly, food particles can remain between teeth, decay, and release compounds that contribute to halitosis. Food particles also live on the tongue and function as harbors for bacteria. Using an antibacterial mouthwash and brushing your teeth daily will drastically reduce the incidence of halitosis. There are various methods dentists use to diagnose halitosis. First, they'll smell your breath and rate it on an odor scale. Second, they might scrape the back of your tongue and rate it from there. Third, dentists can use instruments called halometers and gas chromatography to determine the level of sulfur compounds in your breath. Acid reflux causes halitosis. If you are worried that acid reflux causes halitosis, you have plenty of options. Your child may be suffering from this problem, and you can help him or her get a better oral hygiene routine. You can schedule more regular dental cleanings and encourage your child to brush their teeth regularly. Until you have a more permanent solution, you can use mouthwashes, lozenges, and toothpaste. In a recent study, a group of 565 individuals with GERD and halitosis responded to a questionnaire about their condition. Those who reported having halitosis also reported experiencing GERD, and a higher incidence of esophagitis and GERD symptoms than those who did not. Furthermore, the group had a higher prevalence of gastric ulcers and chronic gastritis. In addition to GERD and acid reflux, people who suffer from halitosis also have breathing problems, which can also contribute to a bad breath. During sleep, the acid in the stomach reaches the back of the throat, causing inflammation. The inflammation and irritation of the throat causes shortness of breath, and can result in coughing, choking, and coughing. This can cause serious issues for both your oral health and your health, including the development of respiratory diseases and asthma. Furthermore, researchers have also found a relationship between acid reflux and obstructive sleep apnea syndrome, which is characterized by a lack of oxygen in the blood. Symptoms of halitosis. If you've been suffering from halitosis for years, you might be wondering how to cure the problem. Halitosis can be caused by a number of factors, including poor oral hygiene, smoking, and dry mouth. Fortunately, there are many ways to cure this common problem. Here are 3 ways to eliminate bad breath for good. First, see your dentist. Dental checkups can reveal hidden problems that are contributing to bad breath. If you're experiencing frequent and intense halitosis, you should schedule an appointment with a dentist. If you're suffering from chronic sinusitis, saline nasal spray can help you breathe better. Antibiotics, such as metronidazole, can also reduce the concentration of sulfur-producing bacteria in your mouth. If you're unsure of what is causing your halitosis, consult your dentist, doctor, or chemist. You might even be surprised to find out that a halitosis cure is available. Visiting a dentist is also an excellent way to alleviate your symptoms. Having a clean mouth is the best way to improve your oral health and freshen your breath. Moreover, a dentist can check for other underlying health conditions that may be contributing to your bad breath. By taking a look at these potential issues, you can eliminate the condition forever. Also, your dentist can give you advice on how to improve your oral hygiene. Home remedies. If you suffer from halitosis, you may be looking for a home remedy. This article will provide you with a few effective methods that will help you get rid of bad breath naturally. Citrus fruits, for example, can freshen your breath. They contain chlorophyll, which neutralizes bad breath. Additionally, you can make a mouthwash from cloves or mint. You may be aware that some medications can cause bad breath, but this is not a halitosis cure in and of itself. Several other medications can cause halitosis, as well, so you should always talk to your doctor about alternative medications. Aside from these, you can also try a number of different home remedies for halitosis. Try the following tips and see if they work. Garlic, onions, and other pungent foods may contribute to the odor. Garlic, onions, and radishes are all known to contribute to halitosis, and eating them can be a source of odor. Additionally, drinking tea may help. Green tea contains polyphenols that inhibit the growth of bacteria and help them produce less hydrogen sulfide. Both types of tea can help with halitosis. The first step in finding a halitosis cure is to determine the source of your bad breath. Many people have halitosis due to a health problem or a habit. If you have gum disease, you may need medical treatment. For some people, smoking causes bad breath. Smoking also increases the risk of gum disease, which in turn can cause halitosis. We are so grateful that you stayed to the end.